Hello, this is Dr. Diana, and in this presentation, we are going to discuss the nursing process.
The nursing process is the foundation of nursing practice. It's a systematic and scientific method that helps us think and act in a clear, organized way. Developed in the 1950s, it highlights the nurse's independent role in patient care. It has 5 key steps: assessment, data analysis, or also known as problem identification, planning, implementation, and evaluation. These steps often overlap because as nurses, we are constantly assessing and reevaluating patients. The purpose of this process is to explore the patient's health status, identify actual or potential problems, determine goals, carry out interventions, and then evaluate whether the care was effective. Let's break down the 5 steps. First, assessment. This is where we collect information: patient statements, family input, test results, and observations. We gather information, organize, and validate data. Next, analysis or problem identification. Here, we sort the data and decide what health problems exist. We also analyze cues, prioritize them, and write nursing diagnoses. Third, planning. The nurse and patient set goals together. These goals are stated as expected outcomes. Interventions are chosen to help achieve these goals. Fourth, implementation. This is where action happens. The nurse carries out or delegates the planned interventions and documents how the patient responds. Finally, evaluation. Here we decide whether the goals were met. If they weren't, we adjust the care plan. Nursing care is always dynamic, constantly changing based off of the patient's needs. Here we have a figure that just shows how interactive the nursing process is when it's in action. The Clinical Judgment Measurement Model, or CJMM, expands the traditional nursing process by adding more detail about how nurses make decisions. It emphasizes that patient care is always in context, meaning that each situation is unique and requires flexible thinking. The model begins with recognizing and analyzing cues, then forming and prioritizing hypotheses about what's going on. From there, you generate possible solutions, take action, and finally evaluate outcomes. Think of it as a more detailed roadmap of the nursing process that matches the way we actually think and problem solve in clinical practice. As an LPN, you play an important role in each step of the nursing process. Although some responsibilities belong to the RN, you still contribute via collaboration. For example, you assist with assessment by collecting data and reporting it to the RN, or in some cases, the provider. Problem identification, or writing nursing diagnoses, is the RN's role, but you still help by making the RN aware of what you see, hear, and do with the patient. In planning, you collaborate with the RN and team, contributing your observations to shape the care plan. During implementation, you carry out nursing interventions within your scope of practice, and you may also delegate certain tasks to unlicensed assistive personnel. For evaluation, technically, the formal evaluation that is submitted as part of the patient care plan will be completed by the registered nurse. As the LPN, your role is still vital. You help monitor the patient's responses, report changes, and recommend adjustments. In every step, the LPN is a vital team member ensuring patient care is safe, effective, and coordinated. Critical thinking in nursing means using purposeful, careful reasoning in everything you do. It involves analyzing data, anticipating problems, reflecting on what you've seen before, and creating solutions. Inside the clinical setting, we call this clinical reasoning. Clinical reasoning is the process that helps you make reliable observations and draw sound conclusions from patient data. The end product of clinical reasoning is clinical judgment, your decision about what's going on with the patient and what action is needed. Problem solving in nursing is very similar to the scientific method. First, you define the problem, gather and analyze data, develop possible solutions, and then predict outcomes. The final step is to choose the best solution, carry it out, and evaluate if it worked. Nurses use this process constantly, sometimes in emergencies when fast decisions are required, and sometimes in guiding patients to make informed choices about their care. Here we can see how the scientific method matches the nursing process. While scientists define a problem and gather information, nurses are completing an assessment. While scientists analyze data, nurses are performing problem identification. Planning and implementing solutions are the same in both. Finally, scientists, while they evaluate the results, so do nurses. They also evaluate outcomes. This shows why nursing is considered a scientific discipline. It follows a logical and evidence based process. Skills for critical thinking. Strong critical thinking begins with foundation skills. You must be able to read effectively, picking out important information as you read. You also need to write clearly and concisely, listen attentively, and communicate in a way that is clear and logical. One tool that helps students develop these skills is concept mapping. Concept maps help you connect assessment data to nursing diagnoses, interventions, and outcomes. This provides a visual way to see how patient problems and nursing care are linked. Figure 2 shows concept mapping. This is a concept map of demands on a nursing student's life and associated responsibilities. As you can see in pink is the student. Around the student is exercise, work, home chores, sleep, eating, social activities, community, church activities, and branches into school, which has its own branches. Other classes, nursing clinical. There's also nursing lab. All of them have tests, reading, study, written work, and more. This helps you to identify the power of concept mapping and how it might be transferred to patient care. What are the attributes of a critical thinker? A critical thinker has certain attributes that go beyond technical skills. They are open minded and willing to question information. They are persistent in seeking solutions and aware of their own biases and limits. Critical thinkers use systematic and logical reasoning, anticipate potential problems, and always verify data for accuracy. They also strive for improvement and excellence in patient care, while showing empathy, honesty, and realism. These qualities make critical thinking a professional standard in nursing. Critical thinking in nursing is more than just following steps. It requires knowledge, skills, and experience. A nurse's professionalism and self confidence directly influence their ability to think critically and solve problems. We also rely on evidence based practice, or EBP, which integrates the best scientific evidence with nursing expertise and patient preferences. This helps us provide care that is safe, effective, and tailored to each patient. To support this, facilities provide EBP tools like procedure manuals, electronic resources, and professional guidelines from organizations such as the American Association of Critical Care Nurses, or AACN. These tools guide us in applying research to real patient care. The nursing process and the clinical judgment measurement model work hand in hand. First is assessment. We gather and record patient data, recognizing cues that point to health problems or risks. Second, we move to problem identification. We analyze the data, group related information, and form hypotheses. We then select the most important nursing diagnoses to address. Next is planning. This is where we create solutions, establish specific goals, and plan cost-effective interventions that promote wellness and independence. Implementation means putting the plan into action. We prepare, perform interventions, and record patient responses. Adjustments may be needed in real time. Finally, evaluation asks, did our interventions work? If the outcomes were not achieved, the care plan is modified or terminated as appropriate. In nursing, critical thinking is essential for setting priorities. Not all problems can be addressed at the same time, so we must decide what is important. We divide problems into levels. High priority problems are life threatening and must be managed right away. Medium priority problems threaten health or coping ability and should be addressed soon. Low priority problems may be important but can safely wait if needed. Prioritization is guided by Maslow's hierarchy of needs, starting with physiological needs like breathing, circulation, and pain control. When organizing your work, ask yourself, what will happen if I don't do this task on time? For example, a patient's stable vital signs can be taken slightly later without major risk, but a diabetic patient's blood glucose and insulin must be managed right on time. Other factors include surgery schedules, patient stability, how long tasks will take, medication administration, unexpected problems, and provider rounds. Remember, priorities change as conditions change. Recheck your plan every 2 hours during your shift and reorganize tasks as needed. Here we see Maslow's hierarchy of needs, which is an important tool in nursing when setting patient care priorities. At the base of the pyramid are the physiological needs, things like food, water, elimination, rest, oxygen, and physical activity. These are the body's most basic survival requirements, and they must be met first before higher level needs can be addressed. The next level is safety and security. This includes physical safety, such as preventing falls, infection control, and stable vital signs, as well as emotional safety, like having a secure environment and protection from harm. After that, patients need love and belonging. This means meaningful relationships, emotional support, and feeling connected to others. As nurses, we can support this by encouraging family involvement, active listening, and compassionate care. Moving higher up, we see self-esteem needs. This includes helping patients feel respected, valued, and capable. Encouraging independence and self-care and recognizing their progress are all ways that we can support self-esteem. Above that are cognitive and aesthetic needs. Patients want to learn, understand their condition, and experience beauty, order, and balance in their life. Providing education and promoting a healing environment supports these needs. At the top of the pyramid are self-actualization and transcendence. Self-actualization means reaching one's potential, such as personal growth or achieving a life goal. Transcendence goes even further, helping others achieve their potential or finding meaning beyond oneself. In nursing practice, we always start with the most urgent, physiological and safety needs, before moving up the pyramid. This model helps us prioritize care, making sure that what's most essential to survival and stability is addressed first. Only then can we support patients in achieving higher level emotional, social, and spiritual well-being. Throughout your nursing career, you will frequently hear reference to Maslow's hierarchy of needs. The next step in the clinical judgment measurement model is prioritizing hypotheses. In this case, the patient with chest pain has the greatest risk of an unfavorable outcome, potentially a heart attack. This makes them the highest priority. The patient with the bleeding chin wound is lower risk because pressure can usually control the bleeding until treatment. The patient with fever and cough has the lowest immediate risk, since waiting briefly is unlikely to cause major harm. In this step, we generate solutions, choosing the safest, most logical order of care. The nurse decides to treat the chest pain patient first, then the laceration, and then the fever and cough. This kind of reasoning happens constantly in nursing, not just in emergencies. Nurses use clinical judgment to decide which intervention to do first, which patient to check on next, what information to give families, and even how to assign staff tasks. The ultimate goal is safe, evidence based decision making that prevents harm and supports the best patient outcomes.